Day for this Friday and none too soon. Well, recently, Molly, we've had a chance to visit with the folks from Broadlawns and learning more and more about this place that will really open your eyes. And with us this morning, we do have Dr. Christy Benson. She's an ophthalmologist from Broadlawns. And first of all, we need to know a little bit about you. We're going to run you through the paces. Where are you from?
I'm from the good town of Harlan, Iowa.
So you're one of us.
Yes.
That's a good thing.
Yep.
That is
the pride of Shelby County.
Where'd you go to school? Which school? I went to a lot of schools. So I went to Harlan Community High School, then I went to Creighton for undergrad, then I went to University of Iowa for medical school, then came to Broadlawns for my intern year, then I went to University of Nebraska, the Trulson Eye Institute for my ophthalmology.
Oh, really?
Wow. So you're a learned woman. You know, that's great.
Yeah. So if you ask me where I went to school, that's okay.
We wanted the whole gamut. I was very interested.
Well, how did they get you back here home into the state of Iowa?
During my training at Broadlawns, I really loved working with the physicians there and the Broadlawns mission. And so during my whole residency, they were kind of, you know, they would call and they would invite me back for guest lectures, and kind of every year I would come, they would say, so when are you going to come back? And so they kind of, I don't know, I was always thinking about Broadlawns during my training, and when they invited me to interview, it was kind of a no-brainer.
Yeah, and the thing about Broadlawns that we've learned over the past couple of months here is that Broadlawns has really changed over the past several years, and you folks, seriously, you'll be amazed at what Broadlawns has to offer.
Yeah, no, Broadlawns has changed a lot since I left 3 years ago and now have returned. So our ophthalmology department has expanded, and so now we have a more comprehensive ophthalmology department. My partner is a retina specialist. We have brand new lasers. We have a brand new cataract surgery suite.
Who are we looking at here?
Yeah,
do you know who this is?
Let's see. That looks like Dr. Mandrakia.
Is he an ophthalmologist with you there at Broadlawns? Or
no, he's my boss, actually.
Oh, you better be nice to him. He's probably one of the nicest guys you know, isn't he? Yeah.
So these are some of the doctors here at Broadlawns, just kind of showing. So people, if you go down there, these are some of the faces you'll see at Broadlawns.
For people who don't know, tell us what an ophthalmologist does. What's your area?
Sure. So an ophthalmologist is kind of, well, we're a physician first and foremost, and so we treat medical diseases of the eye. We also do eye surgeries, and we treat certain diseases with lasers and injections, and so we have kind of more extensive training than, say, an optometrist who's, so we go to medical school first, and so we're a physician first and foremost, and then we get specialized training in the eye.
So tell us on a day-to-day basis, what are some common things that you do there?
Well, I'm in clinic 4 days a week, and then I'm in surgery on Thursdays.
What do you do? What type of surgery do you perform?
So mainly doing cataract surgery, doing some other eyelid procedures and surgeries, do some glaucoma laser procedures, and other different laser.
Now, you mentioned retina specialists, and that is something that is sought after, and you guys have it at Broadlawns.
We do. We have a great retinal specialist at Broadlawns.
I don't know what that means.
So when I think of that, I think of a detached retina from an injury.
Well, you can get a retinal detachment for a lot of different reasons, not just trauma. But so it may seem strange to you all, but ophthalmologists tend to specialize in different parts of the eye.
Okay.
So not only are there doctors for just the eye, there's doctors for the back of the eye, and then the front of the eye, and then just for the optic nerve.
Wow.
And then you have the eyelid specialists, and so there's a lot of different subspecialties in ophthalmology. So Dr. Lawler, he's at Broadlawns, he's my partner, and he specializes in the retina. And he's glad to have me there so that he can focus more on the retina and I can focus on the rest of the eye.
There's a lot of people that are dealing with some retina problems right now, especially as the population is getting older too. Now, are there some things that can be done for that?
Yeah, absolutely. Kind of within the last 10, 15 years, there's lots of new treatments for macular degeneration. There's ongoing research. At the Trulson Eye Institute where I trained, I think they have 31 retinal studies going on right now, and so yeah, there's tons of research going on in ophthalmology. As the population's getting older, there's just going to be more and more people with eye diseases and eye problems. And one thing I'd like to mention about cataracts is that there's a lot of misconceptions about cataracts out there. What I tell my patients is, if you live long enough, you're going to get cataracts. So cataracts are like gray hair. So usually I start seeing the beginning signs of cataracts in the age 50-ish range. And so
Lou, I'm over here.
So when I tell my
What, Jason?
So when I tell my patients they have cataracts, they start to kind of get anxious and nervous, and they're like, "What? No one ever told me I had a cataract before." And in the beginning stages, there really are no symptoms.
No, what is a cataract for those people that they hear it 100 times?
Yeah.
What is it?
Okay, so behind the iris there is a lens that sits. Your eye is like a camera, and so the lens of the eye sits behind the iris, and it's what helps focus and refract the light that enters in through the cornea. So anyway, the lens when we're born, for the most part, is clear. And then as we get old, these proteins and other cells degenerate, just like with normal aging, and they become cloudy. And so a cataract is just a cloudiness of the lens. And it can happen at different ages depending on nutrition and whether you have any other.
So it's like your headlight getting foggy if you leave it out in the sun too long.
Exactly,
Okay.
or like a dirty window.
Is it a spot or is it a layer, or can it be both?
No, well, the lens is like an actual structure, I think. And so basically it just becomes cloudy, and there's lots of different types of cataract. You can develop a cataract in the front part of the lens, the back part of the lens, the middle part. You can be born with a cataract. So you got to rip
it out and put a new one in, or what do you have to do?
Well, we don't want to rip it out.
Well, I know, I know that. Okay, sorry. Sorry for the phraseology, but that's basically you're taking it out and replacing it. Yeah.
So okay, I guess I can explain the kind of the basics of the procedure.
Okay.
So how I tell my patients is where the white meets the clear part of the eye.
Okay, so far so good.
Okay. So this is all done under a high-power microscope. And anyway, it's a couple millimeter incision.
Okay.
And then I stick an ultrasound probe in, and I break up the lens into tiny pieces, and then I vacuum out those pieces of the lens. Yep. And then I replace it with a lens implant. And the nice thing about these lens implants is most of the time you can neutralize your glasses prescription to where a lot of people don't have to wear glasses for distance vision after cataract surgery.
Okay.
You go in like right here? Or how do you get to the back of the eye?
Where the clear meets the white.
Yeah, where the white meets the clear part. Yeah.
That's crazy.
And
I had no idea.
That is so cool.
It does leave a scar, but you can't tell it by looking at someone. You have to look under a microscope.
All right, but that's the one way you can correct that type of thing. But a lot of things also are corrected with glasses. You guys have a department for that is getting bigger.
We have an optical shop.
I didn't know that either.
Yeah, I was surprised too when I came and interviewed. They were talking about the optical shop, and I was like, well, there was no optical shop when I trained there. So yeah, it's actually expanding. We've outgrown our space, and so I already looked at the blueprints for the new planning of the clinic or the optical shop, and so and we're going to have some higher end frames now and a more expansive selection once we get that into that space.
All right, folks, seriously, you really do need to check out Broadlawns. If you've driven by it 100 times, we know you have, but when's the last time you pulled in there and took a look around? You might be very surprised. Tell everybody where Broadlawns is located.
All right, so 1801 Hickman is the address, so it's right off
MLK.
Yep, right off MLK. Get off on Hickman, and there'll be signs. It'll say Broadlawns, and there's an arrow. So.
Well, there you go. Well, very nice to meet you.
Yeah,
you
thank
did
you.
a
That
good
was
job.
interesting.
See, it wasn't so hard, was it?
No, it wasn't. Thanks for inviting me to come on the show.